In this increasingly complex world of cardiovascular care, it can be a frightening situation for the patient who has a procedure that has been recommended to him, like the case under discussion now where perhaps inappropriate stenting was performed on coronary arteries of patients. Patients in that scenario want to know who to go to or how to best judge whether the procedure itself or surgery for that matter is appropriate. Obviously the internet now is a huge resource, but you have to be careful where you go to get your information. One thing that I always recommend to patients is most patients who are in this type of scenario have a long-standing relationship with a primary care doctor or an internist. And that is the first person I would have them discuss the advisability of doing a procedure. I do want to caution people because the majority of stenting that is done in the United States is done for heart attacks, and those are not at issue here. What is at issue in this situation are patients who have stable angina and who are being managed as outpatients. They undergo a cardiac catheterization, and the doctor comes to them and says that they've got coronary disease and may recommend stenting a vessel or two. In that scenario, some studies suggest that perhaps as many as 50% of the stents that are done in this country may not be appropriate, and I emphasize may. So again, if it's an emergency, by all means undergo the stent, don't delay. If it is not an emergency and it's being recommended, I advise a patient to speak to a physician with whom he has a relationship. You should trust your doctor's recommendation, especially someone who's been following you over the years. If you are not in that scenario, you can speak to a physician in the hospital or in the clinic, ask to speak to another cardiologist or a heart surgeon for that matter, to get their opinion as to whether the procedure should be performed.